Hi, this is Ellen O'Connor. I'm the Executive Director at Dave's House, and we're checking in today with Carolyn Kreuzpaintner from Aspire Health. Carolyn, can you introduce yourself?
Hi, my name is Carolyn Kreuzpaintner. I supervise Kate's Place Clubhouse and the Dave's Houses.
And we wanted to check in with you. I know, Carolyn, you and I talk all the time, but our supporters really were curious how the Dave's House residents were doing with everything going on with COVID-19. And we know that you've had to make special preparations there at the clubhouse and our houses. Can you tell our supporters a little bit about what's been going on?
Unfortunately, we have had to ask our Dave's House folks and some of our other community members to not come into the clubhouse because most of them come in on the bus and we don't want to bring in any unknown contaminants into the clubhouse. But we do have members that live on property and all they have to do is walk, and it's a pretty controlled environment. The staff down at residential takes them to the grocery store, brings them back. So it's probably about 25 folks still per day that are coming to the clubhouse. Our Dave's House folks, we keep in communication with them by phone, email, text. Shauna, our case manager, is making sure that all their appointments are set because now it's all Zoom or telephone appointments. So we're not even really asking people to come onto property to do a telehealth appointment. So Sean is helping getting all that arranged, making sure that medications are getting picked up, or we're changing pharmacies so that they can get delivered. Because our Dave's House folks are being very conscientious as far as social distancing.
And what would you say is your biggest need right now? I know we get a lot of calls saying, we'd like to do something to help the Dave's House residents. What can we do to help? What would you say would be your biggest needs?
They're being very self-sufficient, but their needs are very similar to our needs. Toilet paper, sanitizing types of things, hand sanitizers, Lysol, wipes. So their needs are very much like ours. So, I mean, if people had an abundance of, we certainly would love to get them to the clubhouse, and then we can get them to our Dave's Houses.
And we had some of our supporters, including Advent Health and several other supporters, have donated cloth masks as well as medical masks, and they were able to drop them off this week. Is that something that you still need? Or I know some of your Aspire Health partner agencies are still looking for those, right?
The masks that were given for Dave's Houses, we have enough of those. I think those will certainly hold our folks over until this crisis is over. We do have several programs with Aspire that one of our programs, the home program, they have like 64 children right now and like 20 some mothers. So they're very much in need because they did have, somebody did test positive in that program. So they do want to mask everybody. That's a lot of masks. So we did donate some of the ones that Advent Health had given us to that program.
That's great. So that is something you still need if people had the opportunity to donate some.
Yes, with Aspire, yes, we definitely need them.
Those clothes behind you, those aren't your clothes, are they?
I'm living here. I only feel that way sometimes, but no, so that we work on some more social distancing. We've moved some of the clothes out of our clothes closet so that we can spread out a little bit more.
Yeah, and you've had to make other operational changes, right? Taking temperatures.
I take temperatures in the morning and in the afternoon because when they go home for lunch break. So we're very diligent as far as taking temperatures, making sure that people feel good. Even if somebody comes back and they have like a 99, I just suggest go home, get some rest. you know, because anxiety and stress has definitely been something that we've also, you know, we've been more diligent on. We've made sure that they're not seeing their therapist, but talking to their therapist on the phone, keeping in communication with their case managers.
And next week, we're hoping to go online with our virtual clubhouse, which some of the residents have expressed interest in. We were going to offer, if there were people from the community that had a special, whether they're a singer or someone, the motivational speaker or an artist or someone that offers a special opportunity to give our residents an outlet into something interesting to keep their mind in a positive state of mind, then we were inviting them to participate and contact us.
That would be wonderful.
That would be fun also. Well, we'll stay in touch with you, and we have
Thank you so much
for all the good work that you and Shauna and everyone over there at the clubhouse is doing.
Well, and back at you guys, we so appreciate your support, and our residents and our members of the clubhouse really appreciate it.
Well, enjoy your weekend and get some rest.
You too. Take care. It's good to see you.
Bye-bye.
Bye.